This is an evaluation of the American Lung Association's Not on Tobacco program by Duncan McDonald. With 87% of adult smokers starting before the age of 18, developing an effective youth tobacco cessation program is a necessary step in combating smoking and the debilities associated with them. The American Lung Association, or ALA's, Not on Tobacco program consists of 10 15-minute sessions conducted once per week. These sessions are usually held within school hours and developmentally appropriate for high school students in teen-friendly language. Group sizes are 10 to 12 students and cover topics including stress management, effects of smoking, peer pressure, and healthy lifestyles. The Not on Tobacco program is the most widely used youth tobacco cessation program across the U.S., with over a decade of supporting research. Participants with the program are high school students ages 14 and 19, are current smokers. The goal is to recruit youth that are addicted to nicotine, predominantly daily smokers, and all participation is completely voluntary. No specific demographics are the target of these interventions, with rural, urban, and suburban communities selected. The Not on Tobacco program aims to significantly decrease youth smoking and reduce the number of cigarettes smoked each day by students who are unable to quit. It is also designed to improve stress management and other life skills and promote healthy behaviors, including eating habits and exercise. The goal is to provide a program that can be disseminated across the U.S. and be effective in a variety of high school settings. Research is continuously being done to determine if the Not on Tobacco program is an effective means of tobacco cessation among teens, and if it's more effective than anti-tobacco programs otherwise offered in schools. Geographic locations and social views of tobacco play a large role in the effectiveness of the program. Lower smoking cessation and reduction rates were found in the South and Appalachian regions, where smoking among adults was more prevalent. Smoking cessation was especially lowest among rural populations. With increased smoking among adults in these communities, children are more likely to grow up surrounded by smoking, including the adults they look up to. In tobacco-growing economies, there is a reduced stigmatization of youth smoking, seeing tobacco as a source of income and not a harmful drug. Governments in these regions spend less resources discouraging smoking, both in education and tobacco regulation, leading to youth being misinformed about the impacts of the use. Also, the lack of government involvement is one reason smoking habits haven't decreased at the rate they have in other regions of the country. Poverty is higher in these rural communities, and teens use smoking as a coping mechanism to relieve stress, which hinders attempts to quit. All these factors impact the effectiveness of Not on Tobacco program. The American Lung Association developed the Not on Tobacco program specifically towards use by making the content developmentally appropriate, using language familiar to teens. Due to social pressure to fit in and rapidly changing language and trends in high school students, the need to tailor a program specifically for this age group is strong. Not on Tobacco program content covers topics such as peer pressure, developing support networks, and the media, on top of the effects of smoking, preparing to quit, and addressing specific issues teens face in their social lives. The program is offered in a gender-specific setting with same-gender facilitators to address the differences in social perspectives among male and female students. Also, the program is voluntary and offered during school hours, giving it the feel of an educational experience and not impacting on students' social lives. The short sessions ensure participants are able to keep attention throughout class. Despite the NOT developers' attempts to create a program relevant to students ages 14 and 19, more could be done to incorporate the differences in perspectives across the country. Changes in the content could be made to meet different social and cultural views depending on geographic region and the program is being conducted in, especially communities where it has been less effective. These changes could account for tobacco-growing economies, favorable attitudes towards tobacco, and lack of other anti-tobacco resources. Given that the vast majority of smoking is initiated before 18, the Not on Tobacco program attempts to combat smoking within communities by addressing the issue prior to 18. People who start smoking at an earlier age develop a more severe nicotine addiction than those who wait until later in life. There is evidence that this might be the most effective time to prevent smoking and from smoking becoming a health issue. Not on Tobacco promotes smoking cessation and reduction within youth, as well as encourages healthy lifestyle choices provided by a comprehensive plan to improve overall health within the community. The key development players in the Not on Tobacco program are the West Virginia Prevention Research Center, or PRC, and the American Lung Association. Non-tobacco was developed by the West Virginia PRC researchers Kimberly Horn and Jerry Dino as a community-based teen smoking cessation program. After the initial trials, NOT was adopted by the ALA as an effective method, and the American Lung Association worked to coordinate the program into widespread use. The American Lung Association developed a system to recruit and train facilitators to carry out the program, while the West Virginia PRC continued to conduct research on its effectiveness to ensure the initial results were replicable among all demographics. The results of NOT trials were then advertised on the ALA's website to further promote it as an effective program. Dissemination of this project was carried out by researchers and biostatisticians to develop and analyze the successfulness of the NOT. The program was supported by healthcare administrators at the ALA in identifying its value, school health coordinators, teachers, nurses, and volunteers as project facilitators, along with community health workers, supported NOT by promoting the involvement within schools and the community. All levels of government, community organization, and coalitions have a vested interest in the health of school-aged children to reduce the effects of tobacco-related debilities. These organizations play an important role in the funding and implementation of NOT programs within the communities they represent. Government organizations and coalitions such as the West Virginia State Health and Education Departments and the Coalition for Tobacco-Free West Virginia also provide feedback for the program to ensure it's as effective as possible. Students learn cultural norms and healthy lifestyle choices, as well as academic skills in school. Therefore, schools have a responsibility to combat unhealthy habits such as smoking. Additional stakeholders to the schools include NOT program facilitators. These are individuals who instruct the weekly NOT programs and classes. The facilitators are teachers, nurses, or school administrators with interest in promoting healthy lifestyle choices for their students, but also can be volunteers concerned about the youth within their community. Students between the ages of 14 and 19 are also external stakeholders of the NOT program, with over 2/3 of teen smokers saying they would like to quit. Students are involved in the program because they are motivated to quit smoking and are seeking a practical method to do so. Lastly, the tobacco industry can be affected by the NOT program. The majority of adult smokers begin before the age of 18, so the widespread effective youth tobacco cessation program would severely impact the amount of cigarettes sold, both immediately and in the future. Cooperation from many sectors of the community was necessary to implement the NOT program. State and local school systems had to agree to allow the program to be run within their schools. Volunteers were necessary to donate their time for training and facilitating the program. Community support was also necessary to allow the allocation of funding to be placed towards tobacco cessation, and parents allowing the kids to be taken out of class once a week to partake in the program. The NOT program was funded in schools both by grants and taxes. Organizations like the Centers for Disease Control and Prevention and the American Lung Association provided grants to schools to implement the program, and researchers to conduct more research on the efficacy of NOT. Costs for running the program were also paid by tax dollars in the form of state tobacco initiatives and school systems allocating some of their funding to offer the NOT program curriculum. Additionally, alternative funding was gathered by donations from individual donors, corporations, and foundations, allowing for greater implementation of the NOT program in schools. Challenges faced impeding the spread of tobacco cessation programs include differences in opinions at the state, regional, or local levels, lack of trained personnel available to implement the programs, and intervention from tobacco industry opposing programs that negatively project the use of their product. A successful way to gain community support from the NOT and tobacco program would be a four-pronged marketing approach to teach the community that teenage smoking possesses a threat to the adolescents. The first step would show that there is a problem or threat. The second would show that there is a solution to the threat. The third would show that the community is capable of implementing this program. And the final would show that these challenges are consistent with society customs by presenting the communities nationwide have a successful reducing smoking cessation model. The first stage of marketing approach would be to increase awareness and concern, which are of the negative health impacts of tobacco. State-sponsored anti-tobacco media is an effective tool to alert the public of the negative impacts of tobacco, as well as strengthen anti-tobacco attitudes in youth. In conjunction with the campaigns implemented by state anti-tobacco initiatives, media campaigns would be run in schools prior to recruitment of NOT participants. Additionally, pamphlets containing similar information would be sent home to the parents of the students participating in NOT with the consent letter explaining the dangers of continued tobacco use. The media campaign would increase awareness of the threat of tobacco use to students and their parents and influence the perceived susceptibility of disease as a result of these habits. The next step in gaining support of students to participate is by displaying there is a solution to the problem. This marketing can be done through advertising in the schools and information sent home to parents. Information conveyed to achieve these results would highlight NOT being the most effective school-based tobacco cessation program. It would also emphasize that 67% of teens that did not quit reduced the amount they were smoking each week. Marketing and endorsements by the American Lung Association, CDC, and Substance Abuse and Mental Health Services Administration, as well as the National Cancer Institute, would also show the community that NOT is a widely accepted and effective program, a society norm, which is introducing them to the step 4. Developing the belief that implementing youth tobacco cessation programs occurs nationwide, which would increase the support of the community. Communicating the ease of completing the program would be an important step in generating the belief that anyone is capable of doing it. Marketing the NOT program to gain support of state and local government health departments and administrators within the school district consists of generating a belief in response efficacy to the NOT program. The marketing program needs to show a way to reduce teen smoking while maintaining cost effectiveness due to community capacity to support and implement NOT. Projecting the result positively can be done by presenting the extensive amount of research done on the intervention program, as well as the 15 to 19% effectiveness of the program, which is among the highest reported in scientific literature. Also, the limited funding allocated toward youth smoking cessation generates the need for a cost-effective approach. Implementation of NOT program costs about $526 per school, including training facility, room and board, all the training materials, and compensation for the program administrators. Finally, the marketing method must highlight the program's extensive network of volunteers, cooperation